Ministry of Health of Ukraine. Krok 2. Medicine. Year 2020, number 053. A 26-year-old man complains of chills, rhinitis, dry cough, and fever up to 38 degrees C. Examination shows him to be in a moderately severe condition. There are small pale pink non-merging spots on the skin of his back, abdomen, and extremities. Palpation reveals enlarged occipital and axillary lymph nodes. No information about vaccination history could be obtained. What is the likely etiology of this disease? A. Meningococcus. B. Epstein-Barr virus. C. Mumps virus. D. Streptococcus. E. Rubella virus. Lymph node swelling, lymphadenopathy, is fairly common and usually not serious because it goes away by itself, or with antibiotics. In rare cases, the condition becomes more serious. If a person only has swelling in 1 to 2 lymph nodes, an infection is likely in a nearby part of the body. For example, swelling in the lymph nodes of the throat typically indicates some type of throat infection. Causes of swollen occipital, posterior cervical, lymph nodes, viral infection, rubella. Mononucleosis. Bacterial infection. Local bacterial infections in the throat or nearby skin. Impetigo of the scalp, and cat scratch disease. Fungal infection. Ringworm. Insect. Head lice. Autoimmune condition. Scalp psoriasis, systemic lupus erythematosus, amyloidosis, rheumatoid arthritis, sarcoidosis, eosinophilic granulomatosis with polyangiitis, Churg-Strauss syndrome. Cancer, lymphoma, melanoma. Rubella, German measles, may cause a mild illness in children and adults. About 25 to 50% of adults infected with rubella will not experience any symptoms. A red rash is typically the first sign of rubella, generally first appears on the face and then spreads to the rest of the body, and lasts about 3 days. As it spreads, it usually clears on the face. Symptoms may occur 1 to 5 days before the rash appears, such as low-grade fever, headache, pink eye, sore throat, swollen and enlarged lymph nodes, usually in the back of the neck or behind the ears, runny nose, cough, and general discomfort. Mumps is characterized by the puffy cheeks and tender, swollen jaw, in a result of swollen salivary glands under the ears on one or both sides, parotitis, following fever and headache which may begin a few days before. Group of streptococcal infections are a number of infections with Streptococcus pyogenes, a group of Streptococcus, gas. The infections include streptococcal pharyngitis, strep throat, impetigo, and scarlet fever. Epstein-Barr virus, human herpesvirus 4, can cause infectious mononucleosis, mono, and other illnesses. The symptoms of the infection can include fatigue, fever, pharyngitis, swollen lymph nodes in the neck, splenomegaly, hepatomegaly, and rash. Meningitis caused by Neisseria meningitidis, meningococcal meningitis, can be differentiated from ones with other causes by a rapidly spreading petechial rash, which may precede other symptoms. The rash consists of petechia on the trunk, lower extremities, mucous membranes, conjunctiva, and occasionally, the palms or soles. The answer is E. Rubella virus.